During the legislative session, lawmakers considered a number of bills addressing mental health in Utah. For more on that, we turn to Taryn Hyatt. She is with the American Foundation for Suicide Prevention. Taryn, welcome back to the show. Glad to have you with us, as always.
Thanks for having me. It's good to see you.
You as well. Let's start off with suicide in Utah, the overall picture. We are one state that has been hit really hard, but I understand we've made some progress in the last few months. Talk about that.
Yeah, we definitely have. You know, the thing that was unique to COVID is we had folks tracking, real-time data, looking at what was happening with suicide in our state during that time. While we did not see an increase in suicide death, we did see an increase in help seeking and crisis, right? People were struggling. But we are on track to see our fourth year of a small decrease. In fact, the United States saw its first decrease in suicide death ever. I mean, in the last 2 decades, back in 2019. So we're on the right track, but we need to keep this momentum going and ensure that we do not see those spikes that we could still see due to COVID.
It's quite incredible to hear you say that, Taryn, because when you think about the last year, all the isolation, all the sadness, and people, instead of making that decision, we're actually turning to help instead. That's pretty incredible.
I think that's the highlight of COVID, right? We saw people for the first time speaking openly because we all were in that same boat of struggling with our mental health. It took away some of the stigma, and we knew that it was important to get support. So I'm grateful for that help seeking.
Okay, I've covered several stories with you over the years on issues that the legislature has been working on. So let's get right to what was done this year for suicide prevention and overall mental health in the state of Utah. 2 bills that you were really fighting against right off the bat were the 2 bills that dealt with transgender issues. One would ban the medical procedure from a minor. The other would ban female transgender athletes from competing in high school sports. Why was it so important to you to see those 2 bills die?
Because our transgender youth and humans in our state need to be validated, seen, accepted, and a part of our community. When we look at suicide prevention specifically to our LGBTQ community, the protective factors are inclusion, being a part of. Sports is a protective factor. So for us to target an already vulnerable population and taking away something that they just want to participate in or be a part of was detrimental. You know, we had sharp survey data that has let us know that our transgender youth experience fear at school, in the bathroom, began not being accepted for who they identify as. And so it's just important that, again, we make them visible. We let them be who they are. We love them. We support them. So we were really grateful to see these 2 bills go away so that our transgender youth knew that Utah has your back and we're here for you.
So I mentioned this in the segment prior to this, but I want to get your thoughts on as well. We really saw specifically the athletics bill turn when the governor made a very emotional plea to the representatives and senators of the state of Utah. What were your thoughts when you saw him do that?
I was thrilled. You know, Governor Cox has been a true ally to this community, and he was right. You know, they are simply just trying to stay alive. Can you imagine being born in a body that doesn't feel like the gender that you were born into, and yet everyone is against you in the world? You're just trying to find a place to fit in, and yet here we come at you with, limiting access to medical services or not even allowing you to play on a team sport, when we really haven't seen that even happen in our state. So I appreciate his words. I think we all need to take them to heart. Again, you don't have to agree, but my goodness, we need to come together and support each other and love people in our community.
Let's move to another very important issue, the 988 hotline. We saw that on a national level with Utah Representative Chris Stewart, but Utah lawmakers also making some headway on that. Talk about what was done.
Yeah, so thank goodness for Senator Thatcher and Steve Ellison, who have really championed this cause from its inception, even giving this idea, to our Representative Stewart. We need to have a 3-digit number for suicide prevention. We cannot continue to rely on 911 and inundate them with mental health crisis. And again, we've been asking folks to memorize a 10-digit number, right, for this moment. So to have a 3-digit number that is easy to remember, that is dedicated to mental health crisis and suicide prevention is key. But now that it's going to go live, we need to make sure we have the system in place. The funding is essential. And this bill is really going to help us look at how do we secure that to ensure those calls do not go unanswered.
Okay, let's focus now on another big focus of legislative session, and that was on law enforcement, specifically how they respond to individuals who are having a mental health episode. What progress was made during this legislative session with that?
Yeah, you know, there were so many tremendous bills that focused on our law enforcement. House Bill 162 by Angela Romero, again, is helping to ensure that our law enforcement have training like CIT, like de-escalation. We can't keep calling them to go out on a job if we haven't trained them to do so. And while we do not have access to mobile crisis teams in every, city in our state, law enforcement are often called to do those jobs. So it's important and it's imperative that they have the training and the skill to be able to do so. But then on the flip side, we need to ensure that we are supporting their mental health. More of our first responders die from suicide than in the line of duty. So Representative Kwan brought forth bills that again will implement grant programs for funding for law enforcement to provide mental health resources. PTSD is now a compensable injury. They can get workers' comp to treat the injury to their soul and their brain and their mind for what they see and witness every single day. So we really saw a dedicated focus on supporting our law enforcement in this effort.
Yeah, one of my colleagues here, Jason Wynn, has done a phenomenal job highlighting a series that we call Weight of the Call, and it talks and digs into exactly what you're talking about, the mental health issues that first responders deal with daily. When you think of what they respond to and what they see, and Taryn, I got to ask you, that probably has to do with stigma as well, and changing the stigma to where we're to the point where they're thinking we can start talking about this.
Yeah, and that's the biggest part. That's why I was so excited to see PTSD be, again, an injury that they can be compensated for. You know, if you break your leg, we all rush out and, hey, what can I do to help you? But when I'm struggling with nightmares and things that I'm experiencing trauma, and nobody says a word, you know, that stigma has been so high, and we need to let these folks know that, again, we see you, we love you, we want to support and help you, and it is okay to get help for the things you're experiencing.
Okay, mental health days. We saw that pass where students can take a day off from school if they just need to clear their mind or deal with a mental health issue.
Yeah, and what a victory, right? How many of us in our work lives also need to have mental health days? I think this is something that, again, speaks to what we saw during COVID. Mental health is as real as physical health. So rather than us have to call in sick or lie for our child and say they have a tummy ache when what they really need is just a day to debrief, to take a moment, we need to support that mental health matters, and we have to take care of that. And sometimes that is taking a break and taking a day to ourselves.
And that was a bill sponsored by Representative Mike Winder in the House. One last thing from this legislative session I want to hit on, of course, constitutional carry was one of the more visible and controversial bills. That did create some concern for suicide prevention advocates. However, you found something you liked out of this bill.
Yeah.
Talk about that.
Our biggest concern, obviously, is that we were able to reach 162,000 people who applied for concealed carry permits. There's also funding that comes in that, right? They're paying for this permit. So Steve Elison, again, was able to secure $2 million in funding from BCI to enable us to provide suicide prevention education. Again, we just want folks to own firearms to know we have to store our guns safely. That is how we keep them out of the hands of somebody who could be in crisis, and that is how we save lives.
All right, Taryn, we have about 30 seconds left. Moving forward, you mentioned we're making progress, but there's still a long way to go. What are the most important steps in the coming months and even up toward the next session when it comes to suicide prevention?
We have to implement a crisis system. We do not have the access and the capacity. We were all worried during COVID that, right, if I got sick, maybe I wouldn't have a bed at a hospital. Well, guess what? With mental health, we don't have enough beds. There is not a system in place right now. We need to increase access to services, coverage for services. People can't be told that they have to wait 3 weeks to be able to get in and be seen. So again, we're going to dedicate an effort. It's already in place. We have a lot of things moving forward, but we need to ensure that our mental health is treated just as vital as our physical health.
All right, Taryn, appreciate your work and appreciate your time talking about these important issues. Utah hit so hard by this crisis, especially our youth.
Yes.
Thanks for what you do.
Thanks.
Stay with us. We'll be right back with more Inside Utah Politics right after the break.